Hello, and welcome to 2021 Virtual CHW Summit, where we're elevating the multidimensional skill set of community health workers. My name is Deitra, and I'm a registered nurse and national board certified health and wellness coach. I'm also the CEO and founder of Full Circle Health Coaching LLC. Now, before we begin today, I would like to review some housekeeping items with you. So bear with me as I read through those for you. So as we begin here, just to let you know that this is a pre-recorded session, but the Q&A section of the Thinkific platform is being monitored to respond to any questions that you may have. You can access the discussion tab at the top right of your course player whenever you have a question to ask. And just to let you know, the course player is where you're watching the video now. Just click on the image of the two alternating boxes, then click Create New Post to submit your question. So questions will be answered on the day the presentation premieres. Today's slides and any additional resources pertaining to this presentation are made available inside, again, of the Thinkific platform, and you can find them by scrolling down past this video. As a reminder, we do ask everyone to complete a survey about the session. The survey is located inside the platform again, and you will be prompted to complete the survey at the end of the session or the presentation. And if you do not receive the prompt, you will find the survey in this summit outline. Additionally, please complete the summit survey at the completion of this week. Again, this is very important to Umemba Health as we use this information, every bit of the feedback, to help inform future educational events. And just as a reminder, this presentation has been approved for continuing education hours for community health workers, community health worker instructors, and certified health education specialists. In order to obtain your certificate, you must complete the summit evaluation by April 23rd, so don't miss that window of opportunity. So now, how can you join us on social media or get social with us? So join us on Facebook at Virtual CHW Summit, also on Instagram at CHW Summit. And then remember to hashtag Virtual CHW Summit 2021, elevate your skill set, and CHWs are multidimensional. Now, as we move along, we're going to start talking about A Taste of African Heritage, a curriculum training for community health workers. So, A Taste of African Heritage curriculum training, it is a curriculum that trains CHWs and CHW instructors on how to deliver and evaluate an evidence-based, culturally competent nutrition education program. The African Heritage Diet is an evidence-based program developed by Old Ways, which is a nonprofit organization dedicated to improving public health by inspiring individuals and organizations to embrace the healthy, sustainable joys of the old ways of eating, which are heritage-based diets high in taste, nourishment, sustainability, and yes, joy. So, turning evidence into action with the African Heritage Diet Pyramid and programs. So in 2011, the Old Ways assembled an advisory committee of nutrition scientists, culinary historians, and experts in the African diasporic health and history to develop the African Heritage Diet Pyramid, as you see here on the left. And when the pyramid is used, it was the framework to create A Taste of African Heritage curriculum, which here is the teacher's curriculum on the right. And so the curriculum is actually a 6-week cooking and nutrition curricula. And then, so once the curriculum was reviewed by African American dietitians from the advisory committee, the curriculum was then piloted on a small scale so that it could be refined and, really made a great experience for those who would enroll, would participate. So, and even to today, they're continuing, Always is continuing to receive feedback from the instructors and participants as the program goes on, again, in order to optimize the program. Now, the development of a Taste of African Heritage diet, it covers the diaspora and is basically, based on the traditional healthy diets of Africa, especially West and Central Africa, South America, the Caribbean, and the American South. So, what is so special about the curriculum? Each lesson, again, begins with cultural discussion that informs and educates participants about the traditional foods from these regions, as I mentioned before, of the African diaspora. And so the African diaspora is a term used to describe the mass dispersion of people from Africa, again, primarily from the Western and Central Africa, to different regions throughout the Americas and the Caribbean, primarily during the transatlantic slave trade from the 1500s to the 1800s. Now, the ancestors of African Americans brought many wonderful food traditions to parts of the Caribbean, South America, and the southern states of the US. The combination of these traditional foods, along with the foods they adopted, resulted in resourceful, nutrient-dense culinary traditions rooted in wholesome plant foods. This practice is bridging culinary tradition, and it continues today. So in A Taste of African Heritage, participants get the opportunity to share stories about their culture, which can help others feel comfortable about sharing about their culture. It also helps students make connections and increase their understanding, as well as talk about the misconceptions associated with the African diaspora. And I can share from my experience in being an instructor, a lot of times the participants would say it really was an opportunity to connect to heritage and learning really about how the ancestors ate. Again, which was primarily plant-based, which we'll get into a little bit later here. So again, as mentioned before, this is an evidence-based program. As you'll see that the health studies of the African diaspora about health and nutrition deteriorate as people in Africa and the African diaspora move towards a modern diet or a Western diet or a standard American diet. You may hear it mentioned in either way. But again, the more we eat according to our traditions, there was less chronic conditions, as we'll again talk about that more. And as you participate in the curriculum itself, you'll learn about how many of the diseases weren't even mentioned or was not even prevalent in Africa when a traditional diet was upheld. So again, the blood pressure rises as traditional diets turn Western. And this is another evidence-based study. A Loyola University study measured blood pressure and sodium levels of well over a little over 2,700 people from Nigeria, Jamaica, and United States. And what that result shows was that the higher sodium was in those in the United States. In the medium level, it was Jamaica, and very low in Nigeria. And the last evidence-based approach, health problems follow east to west movement. Another Loyola study compared West Africans to Caribbean populations and to African descendants in the UK and US. So again, as moving away from the traditional ways of eating, many chronic conditions were very prevalent. So now the development of the African Heritage Pyramid, as you see here on the right, it really gives you an idea of what was really on the plates of our African ancestors. So you'll see here largely it was plant-based. So at the bottom of the pyramid, you see the greens, which are prevalent amongst across each region, the greens there. So again, it's a way to inspire and support healthier eating in the African American community through a culturally appropriate and personalized dietary model. It is a way for health professionals to easily incorporate more culturally competent strategies into their dietary recommendations for African American patients. Also, a way to respect and celebrate the different cultures and regions of African heritage. And just to add a little bit here, when it doesn't matter what culture, but when you're able to really connect people to heritage and cultural traditions, there is more of a compliance or an adherence to a lifestyle when it doesn't feel that you're being stripped or your traditions or heritage is being taken away from you. So again, I can share from my own experience as being an instructor, when you're able to show, hey, you can still have those things that are unique to your culture, maybe modifying a little bit to make it a little healthier, having lower sodium, making healthier choices, but still maintaining that tradition. Many times people will continue with the lifestyle. So now, the African Heritage Diet Pyramid, an effective tool for bettering health, as I just mentioned before. So again, it fills the need for a new approach to diet and health for African American. It helps eliminate barriers to achieving better health and nutrition in the African American population. And again, I can say many times when I've had participants from the class or either from coaching, many times they feel that if you say eat healthier, it is equated to, okay, I have to give up familiar foods or that it will not taste good. And we'll talk a little bit more about how that is not so when you're dealing with cultural foods, because the foundation begins with spices. We have to have the spice, have the flavor there in order for us to eat it. So again, it depicts real foods and food groups. It's innovative messaging. It's comprehensive, but yet it's accessible. It's celebratory and inspiring, and it addresses specific issues such as physical, lactose intolerance, the vitamin D deficiency, be it social. Healthy eating belongs to everyone, and historical. And again, I like to share, when we're thinking about the ancestors, it was always about a sense of community. So it's about us eating together, be it was a Sunday supper or during holidays, it was about community. So again, great information here about the program. So why plant-based, and why are we hearing so much about plant-based these days? So here we are. There are several benefits of adopting a more plant-based or plant-powered or plant-forward. You may hear it in all of those terminologies, but I'm going to focus on 3 for the sake of our time today, about the diabetes, heart disease, and mortality. So we have lower risk of type 2 diabetes and better blood sugar control when you're eating more plant-based foods. Lower risk of heart disease, longevity, and many more, like obesity, lowering the risk of some cancers. And as we talked about the evidence-based information, there's a great health study on Old Way's website comparing cancer. So I'll just share this little bit. So it was an opportunity, it was a 2-week experiment, if you will. So it took those from Africa's men in Africa to change, and they ate an African American diet for 2 weeks, and vice versa. There were African American men who then adopted the African diet for 2 weeks. So the African diet, as we mentioned, is traditionally and predominantly plant-based, whereas the African American, the standard American diet, was highly processed foods, a lot of fried foods. And what was shown is that in those 2 weeks, The African men who had no signs of colon cancer or anything of that nature, they started to have colon cancer changes in their cells that were leaning toward colon cancer. And vice versa, the men of African American men that had colon cancer, cancer cells, that improved in the 2 weeks just by adopting the traditional way of eating. So again, there's power in the plants. So feel free to go to oldways.org/health studies to see more about that one, but I felt that it was important to share that as well. So when we talk about diabetes and how it improved, plant-based way of eating improves the glycemic control, and then 23 to 30% lower risk of type 2 diabetes. I just want to share one study with you. There were several studies that were done, but this one really stands out. So bear with me as I read this to you here. So it was some researchers that analyzed the results of 9 observational studies totaling over 300,000 participants to see how plant-based diets, including both vegan. Vegan means no animal products at all, meaning no dairy, no eggs, no fish, none of that. And then vegetarian, they may, they may include eggs, they may include dairy. But again, it was those to see how plant-based diets related to type 2 diabetes risk. And those most closely following a plant-based diet had 23% lower risk of developing type 2 diabetes across the study periods. When healthy plant-based foods such as whole grains and vegetables were included in the definition of plant-based, the relationship was even stronger at 30% lower risk. So again, power in the plants. Now, as we talk about heart health benefits, the plant-based diets are linked with lower cholesterol and lower risk of heart disease. I'm not sure if you're aware, but heart disease is the #1 killer in the US. And in the African American community, it is extremely high. And heart disease, again, as I mentioned, is the #1 killer. And this is above all cancers combined. So it's a great issue here with our heart health. And we want to make sure that we're fueling our bodies with the right food, right nutrition to live at our optimal heart health. So when you talk about cholesterol, many times when the blood is drawn, you look at the cholesterol level, the goal is less than 200. When you think about the LDL cholesterol, so there are 2 areas when you're looking at the cholesterol more, but for the sake of this presentation, we'll talk about the LDL, which is like the lazy, I call the lazy or the bad cholesterol, because when that number is high, that is where you have a lot of plaque buildup and your blood vessels are clogging of the arteries. And then your HDL, I'll say the healthy HDL, what the HDL, you want that one to be a little higher because what the HDL cholesterol does is it takes the excess cholesterol in the body, because your body makes cholesterol from your liver, but when there is excess, your HDL works very hard in taking the high cholesterol away from the heart from the vessels back to the liver so that it can be, removed from the body. So just wanted to give you that little tidbit. But again, here we're showing that the plant-based diet actually lower, the LDL was lower. So the goal for cholesterol is to be less than 200. Your LDL, you want that less than 100, okay? And so here it showed that it was decreased by 22.9%. And then the total cholesterol was decreased by 29.2 milligrams per deciliter. So that is amazing to have plant-based food to lower your risk of heart disease, as I mentioned, was the #1 killer. And so again, I just want to share one little study here about, and there are so many studies that show how a plant-based way of eating can truly help you live at your optimal heart health. But here's another study for you. So here, researchers analyzed data detailing what more than 200,000 people ate over 20 years and separated people into three versions of plant-based diets. Overall plant-based diet includes all plant foods and some animal foods. So that first group was a healthful plant-based diet. That first one, the first group, they included plant-based and some animal food. The second group were a healthful plant-based diet and includes healthy plant foods like the whole grains, the fruits and vegetables. And then the third group was an unhealthful plant-based diet, which included the sugar-sweetened drinks and refined grains. So it is no surprise they found that the second choice, meaning those who chose healthful plant-based foods, the whole grains, fruits, and vegetables, that with them eating fewer animal foods and more healthful plant foods, was linked with a lower risk of developing coronary heart disease. And while eating more animal foods and more unhealthful plant foods was linked with an increased chance of developing coronary heart disease. So again, power in the plants. All right, now how about adding years to your life? Plant-based foods, yes, are linked with longevity. Shifting everyone to a mostly plant-based diet can prevent 11 million deaths per year globally. Isn't that something? So again, I got a study for you. So here, this one shows that people who follow a plant-based diet tend to live longer lives with a lower risk of death from all causes. In a large study of more than 70,000 people in California, the mortality rate for semi-vegetarians and vegetarians was 20% lower than the mortality rate of non-vegetarians. Again, what I say, power to the plate. So here I want to share a few results of the Taste of African Heritage, because in the program, as an instructor, you have pre-assessment and post-assessments. And so I want to share a little bit of that. So again, as I mentioned, for the curriculum, A Taste of African Heritage, a practice test approach that has been evaluated using pre- and post-intervention behavior survey data, there were biometric measurements and blood pressure readings. Based on the strength of this evidence base, the adult A Taste of African Heritage curriculum, how about this, is included in the USDA SNAP Education Library. And studies show that making culturally sensitive modifications to diet programs can lead to improvements in blood pressure, weight, and other health parameters. So again, since the inception of 2012 of the curriculum, A Taste of African Heritage, it has been taught over 300 times in communities across the nation. 90% of adult participants improved at least one healthy behavior, eating more whole grains and vegetables, etc. And in adults, the systolic blood pressure decreased by an average of 4.65 millimeters of mercury over the 6-week period. And so when you think about the systolic blood pressure, this is when your blood is being contracted, the force of the contraction of your vessels, that is when your systolic blood pressure is measured. And then the other part is that 28% of the participants reduced their blood pressure from a full stage, moving from a stage 2 hypertension to a stage 1, or stage 1 to elevated, or elevated to normal, all which was moving in the right direction. Also, I wanted to share that in 2018, Old Ways also debuted the children's Taste of African Heritage, and it has reached approximately 100 children across the country since the debut. And participants in a children's Taste of African Heritage shows improvements in healthy eating behaviors, such as increased intake of whole grains and beans. And we know, even with our children today, high obesity rates, what was used to be called adult onset diabetes. We see a lot of that in the children today. So it's great to be able to introduce this to children at an early age so that they too can live at their optimal health. You know, we want that for our babies. We want them to, you know, live at their optimal health and learn early how to make healthy choices, and even bringing them into the kitchen, because I know from experience myself that when you introduce the children early and have them involved in preparing the food, they take great pride in the end product, and they will more likely eat it because they've had their hand in it. So again, just want to share that little bit with you. Now, a little overview about the program. So the curriculum training goals. Here you'll see some teachers in action here. This was, you know, some of the first group of teachers. But what you have here, the goals, you compare and contrast traditional African heritage eating patterns to modern eating and lifestyle patterns. Again, nothing judgmental, but just how we can benefit, we all can benefit from going back to traditional ways of eating rather than the highly processed food. And then demonstrate understanding of a taste of African heritage eating model based on traditional diets, as I mentioned before, of the African diaspora. And list the chronic conditions that disproportionately impact African Americans as traditional diets or ways of eating were left behind. And then we describe key features of the traditional African heritage diet that contribute to good health and verbalize considerations for tailoring culturally appropriate education using adult learning principles. What you can expect and the course details. So again, just to share with you that you will receive 5 hours of Texas Department of State Health Services certified continuing education. You have 30 days access to the self-paced on-demand learning modules. The instruction that reviews the following. Again, how to deliver the curriculum. And you will hear from me. I do share a lot of best practices of how I started, as well as from other Taste of African Heritage instructors, really kind of helping it to become a turnkey for you. How to provide culturally mediated instruction, how to facilitate group work, and the role of a facilitator, adult learning principles, virtual delivery of the curriculum. When the curriculum began, it really started with it being in-person, face-to-face, multi-sensory experience for the participants. But in 2020, we had to shift in order to accommodate, you know, what was going on with us with the pandemic. So now it can be offered on a virtual platform, but still making it engaging for the participants. And then how to document and collect the data, as you saw before, you know, the results of the class. So you still want to be able to gather that information so that we can continue to help the community live at their optimal health. And then how to get started. Again, helping you, giving you all the tools to be successful in delivering the curriculum. And then additional resources to assist in implementation and delivery. Now, other topics that we'll go over is how to recruit participants. Again, all of this is available for you, and it is hands-on experience from other instructors on what really helped to create an engaging experience from beginning to end, from recruiting to the delivery. So finding your class site, even on how to request grant funding, things of that nature, how to conduct the curriculum with or without a kitchen. Yes, it can be done without a kitchen. And then how to teach the curriculum, be it if you're going to do it by yourself or do it as a team. There have been some, I've taught mine by myself, and I've done different structures. I've done in person, where it may have been a cooking demo, but I like to make it fun and engaging, and I would make it in a sense hands-on style, creating in a sense like a Sunday supper or a soul food Sunday, where everyone has an opportunity to participate. Everyone has an assignment, you know, in preparing the food. And then we would sit together at the table, family style, and have discussion and reflect on the experience from that day. So again, all of that is available in the curriculum. So now the delivery, as I've talked about already, the number of classes are 6. So it's 6 weeks long. The class each week is 2 hours. So you have 1 class per week for 6 weeks. And the number of recipes that you prepare is 2 to 3. It all depends on the recipe. Some may be a little more involved, but really you want to choose those recipes that really, and most of them take about 30 minutes to prepare. So you want it to be able to get to the table quickly. And number of participants for a good engagement and for you to be able to really assist where need be is 10 to 15 is preferred in a virtual environment. And as I mentioned before, the instruction style, it varies. Each class consists of an introduction, historical and nutritional discussion, a cooking lesson, and a time to eat together and reflect. And as I mentioned, the part that's different is that how you would deliver it. If you would do a demonstration style where you're, again, on a virtual platform where you're just demonstrating, or you can have them cook along, and that's a great experience because they're able to prepare it in their home, and it increases their confidence in cooking. So that's an option there for you. Now, what and who should get certified? So here on the right, it's a registered dietitian, public health professionals, health coaches. You can be a chef or not, educators, anyone in the healthcare profession, faith-based leaders, community members. So anyone can teach the class. Why? Because the program teach everyone to teach for anyone working in all the areas that I mentioned before, but you don't have to be a chef because the lessons truly are turnkey. When I tell you the curriculum is turnkey, it really is because it's easy to follow. You have step-by-step guides for preparing and teaching. And again, this course is online, self-paced, an on-demand course that can be completed on your own time. So how do you find out to enroll? You visit Umemba Health Academy, you search for course, you enroll, and this course will launch on May 1st. So here's a picture of a class in action that was face-to-face. So you can have it as engaging, as involved as you would like, you know, getting dressed, you know, to truly enhance that experience. You know, you see the delicious food here, make it fun because we want it to be, again, I know I keep saying engaging, but really you do want it to be engaging and, you know, involving all of the senses, and you can still do that virtually as well. Just inviting people to cook along with you and, you know, create that experience for them. So lastly, I want to say thank you so much for your time and attendance in me presenting on today. So if you would like to sign up as an individual, you can do so, as I mentioned, at the website at Umemba Health Academy. And if you're interested in signing up multiple staff from your organization, or if you would like to inquire about a live virtual training for your organization, contact Quisha Umemba at admin@umembahealth.com. And again, I am Deitra Dennis, and I really appreciate the opportunity to be here before you today and continue to enjoy and get all you can and have a wonderful experience at the virtual 2021 virtual CHW Summit.